I want to welcome everyone to the third annual Epic Baby and Toddler Expo and our first ever virtual edition. Thank you all so much for being here. Community and support is important so much more now than it ever has been, so we're glad to have you all joining us tonight. We've got a great lineup of content for you this week, but before we dive in, I wanted to take a few minutes to introduce myself and a few others. So I am Tara Burgess. I am Epic's Executive Director, and this year is our 40th anniversary. And while it hasn't gone at all the way we had planned, we are thankful to be able to continue to do what we do best, which is to serve families. We have said all along, parenting doesn't stop, not even for a pandemic. And because parenting hasn't stopped, neither have we. We're here for you virtually through programming, our support line, support groups and parent cafes, email, phone calls, texting, whatever you need, we are just one click or call away. We have some great partners with us this week. So first, let me thank our sponsors this year, BlueCross BlueShield, our presenting sponsor. They have been a strong supporter of Epic and the community for many years, so thank you to BlueCross BlueShield. In addition, Best Self Behavioral Health and Kaleida Health have supported our event this year, and we couldn't have done this without them. I'm also happy to introduce Liz Vitrano, Epic's Director of Development and Marketing. Liz, give a wave so everybody knows who you are.
Hey everyone.
So Liz had the extreme pleasure of putting this event together this year. And she did that with some help from Anna Mikatek from BlueCross BlueShield and Dana Roman from Kaleida Health, who were not able to be here this evening. And Liz will also manage things related to technology this evening and for the remainder of the week. So if you have any questions, feel free to search her out, message her in the chat room, send her an email, give her a call, any of the typical ways to get in touch with someone. And I am also thrilled this evening to introduce you to our MC for the event, Mary Friona-Celani. We are so fortunate to have her and her husband Scott emceeing our expo. You may recognize her from Channel 2 or Scott from his musical career. They are also parents to 4 girls and grandparents to a new baby boy. So Mary, thank you so much for being here with us. And we appreciate everyone else tuning in to see what's going on in the world of babies and toddlers. And Mary, I'm gonna leave it to you to take it away. Thank you so much.
Hi, so I'm so happy to be here. Scott and I, my husband and I, love Epic so much. We have for a long time. The work they do is so important to this community, and the outreach that they do makes a difference, and I know that it does save lives, and it certainly helps our community, each and every one of us. My husband was going to do this with me today. He will be here the rest of the week, but he did have to take our 9-year-old to soccer and then dance. And as long as she doesn't dance in her cleats, I will definitely call it a success. I have emceed a lot of events, but this may be the very first time that I actually do it in pajama bottoms, maybe. So there you go. A few logistics before we get started. Every one of you joining us has received an email with the Zoom links for the entire week. So each day is also going to be recorded. So that's really important. You can watch it anytime. And you'll receive a copy each evening once we close. Every night we will have live speakers, the opportunity for questions, and prize giveaways as well. Tonight's theme is health and wellness. So we are talking lactation, postpartum depression, mental and physical health, and we are giving away a doctor-approved Swaddle-Me side sweeper. So be sure to stick around for that. So let's dive in. We're going to go to our very first topic tonight, which is lactation. And we've got a brief presentation from Kaleida Health. Then lactation consultant Deb Finamore is joining us live to take all of your questions. So while this is playing, you can feel free to enter your questions in that tiny little chat box down at the bottom there, and Deb will start answering them right after the video. So.
Welcome to O'Shea Children's. I'm Courtney. I'm one of the lactation consultants and registered nurses here. How can I help you today?
Hi, thanks for having me. I'm 6 months pregnant and I'm on the fence about breastfeeding. I have a few reservations and I was wondering if you could explain it a little bit better for me.
Absolutely. Breastfeeding is an awesome journey to begin. I'm really thrilled that you're here talking to me.
Thanks.
Some of those great benefits of breastfeeding really involve you and your baby. Your baby will have a reduced risk of ear infections and GI disease and even respiratory illnesses. When you provide breast milk to your baby, that actually reduces the rate of obesity and diabetes later on in life. Childhood cancers are lower. It also decreases the risk of SIDS, which is sudden infant death syndrome. For you, the benefits are extensive as well. You have a lower risk of breast cancer, ovarian cancer, even endometrial cancer. Your risk of obesity and diabetes is actually lower as well. Moms benefit from a decreased risk of postpartum depression with breastfeeding. Right? So there's a lot that really can be benefited from by breastfeeding. We're here to help you. Any other questions?
How do I start? Like, is there a way to prepare before I come to the hospital? Is there something I can do to, get a jump start on this whole
Absolutely.
journey?
There's a lot of great information out there. It's kind of confusing when you're looking around and you want to find the right resources. We're here to help you. Many of the hospitals have lactation consultants that you could give a call to. If you wanted to take some prenatal education, like a childbirth class, specifically a breastfeeding class, would be wonderful. There's some places at the hospitals that do that. There's Care Connection, Babies with Beginnings. Even WIC offers prenatal education, so you can get a lot of great information from them. You can also look into different websites. Just make sure they're reputable. Something like the American Academy of Pediatrics is great. You can read a book like The Womanly Art of Breastfeeding. That can give you some great tips as well.
So I can even call you before I even have the baby?
You absolutely can.
Good to know. So am I allowed to give a bottle, or do I have to just exclusively breastfeed?
Well, we want to do what you want to do. So you let us know what your feeding plan is, and we'll do our best to get you there. If you're looking at exclusively breastfeeding, we want you to get off to the best start. So learning about breastfeeding would come number one. And then when you get to the hospital, after labor and delivery, and you have this little bundle in your arms, I would encourage you to do lots of skin to skin. There's so many benefits to skin. It helps to regulate their body after delivery. Their blood sugars are elevated by being skin to skin. And plus, with that proximity, they're able to start breastfeeding pretty well. They don't always, breastfeed perfectly in the beginning. It takes lots and lots of practice, which there's lots and lots of feedings in the beginning. So learning your baby, learning feeding cues, they tell you when they're hungry. That's their communication. And it's before crying. So if they're doing something like moving their hands towards their face, or if you touch their cheek and they're trying to eat your finger, that's actually a sign that they're hungry and you want to put them to rest. They may feed anywhere from 8 to 12 times a day, or even more during cluster feeding times. That's really common, especially in the evening and nighttime hours. Your nurses are available to help you. Here at Oshai, we are baby friendly, which means all of our staff is educated in the basics of breastfeeding and how to help our mothers. We also have lactation consultants on staff day and night. So if you're running into an issue that one of your nurses can't help you with, we can step in and take over, whether it's a tongue tie or flat nipples, or even starting some breast pumping for a NICU baby.
Is there a cutoff for the best time, like the amount of time you should breastfeed before you switch to a bottle, if that was a choice of mine?
Right.
Like a minimum?
Absolutely. So in the beginning, you do have small amounts of breast milk. That's called colostrum. But your baby's belly is really little too. So many moms think they don't have enough, when in fact it's the perfect milk for a newborn. In about 3 to 5 days after delivery, your body responds by increasing that supply, and that's your mature breast milk. We really want you to limit the exposure of bottles or pacifiers until you are really well established with breastfeeding, typically around 1 month of age. The reason for that is just, it's very confusing for babies sometimes to learn this new skill and then learn something else like a bottle nipple. So if they get breastfeeding under control and can learn that really well, they're actually going to be able to bottle feed better around 1 month of age, and they won't be as confused. During that time, you can also start breast pumping. I know you had mentioned previously that you were going back to work.
Yes.
Right?
I'm a little nervous about that.
A lot of moms are. Yeah, and that's kind of a scary thing to think about in the future. We do prepare moms for that by introducing some breast pumping around that 1 month of age, or earlier, unfortunately, if you have to go back earlier. So give yourself at least a good 2 weeks before you go back to start some breast pumping.
Okay.
You can start in the early morning. Usually you have a higher milk level overnight. So you would feed your baby first and then do about 15 minutes, 20 minutes of breast pumping afterwards. Some moms won't see a lot right away, right? But the golden rule of breast milk production is the more you try to take out, the more you make. So by doing that extra pumping, you're actually gradually increasing your supply. Okay. So you can put that in the fridge, okay? Even if it's very small amounts, you can collect that. It's about 6 days in the fridge. And then if you have a fridge freezer, if you're saving milk, it'll be about 6 months in the freezer.
Okay.
And then when you're ready to use that breast milk, you can just thaw it in some lukewarm water. Maybe you have someone else doing the feeding, like dad or a partner or a grandparent. They can step in and do that first bottle feed for you.
So no microwave?
No microwaves, no. That can actually kill the good stuff in breast milk that we want to give to your baby, and it also can cause hot spots.
Okay, perfect, good to know. So you're giving me all this help while we're in the hospital. What happens when I get home and I just am overwhelmed and can't handle it? What do I do? And I don't want to give up.
Absolutely, and we wouldn't want you to. So there are some great resources, especially in the Western New York area. We usually, in most hospitals in this area, will give you information on breastfeeding. And for many questions, the information is right there. So definitely take a look through your discharge paperwork. Sometimes you'll find an easy answer. If it's not there, here at Oshai, we do give you a resource list. It has phone numbers, places you can go to for support and some help and some questions. They include your pediatrician, your OBGYN, WIC has breastfeeding peer counselors to help in those situations. Again, Care Connection, Baby Sweet Beginnings, great places to go to. If you wanted something immediately, we actually have baby cafes that are in the area, and they are during the days of the week at certain times. Oshai also has a baby cafe every Wednesday from 11:30 till 1. It's virtual right now, like most things are, but you can join us. We can help you with breastfeeding, any questions you have. If that time period doesn't work for you, there are other baby cafes in the area. You can just go to www.babycafe.org, USA.org, if that was it. And they will give you the information on where you can go.
That's very helpful. Thank you so much for your time.
You're welcome.
Have a great day.
Wow, a lot of great information there. I'm sure some of your questions were already answered, but Deb Finnemore, the lactation consultant, is here to answer any questions that you might have now. So hi, Deb, welcome.
Hi, thank you.
So glad to have you here.
Thank you. It's good to be back with Epic.
So here's one question from Deborah. She wants to know, what did she say that could kill the good stuff in breast milk? Can you go over that a little bit, please?
What can she do to kill?
No, in the video they said that something could kill the good stuff in breast milk. I think it was putting it in the microwave.
Oh, yeah, you don't want to do that. So I think what you just want to do is either take it from the fridge or the freezer to get it ready to feed. And you could actually, if it's in a little Ziploc bag, put the bag, if it's sealed, in warm water, lukewarm water, or if you're literally giving it by bottle, then you just pour it in the bottle, and then you could put that in a pan with some lukewarm water. You never boil it, you don't microwave it, because that will start to break down some of the components that are in breast milk that you want the baby to have. So I would say pump it and then fridge, freeze, and then lukewarm water.
Wonderful, thank you. And here's another one from Jamie. She would like to solely pump, then bottle feed. When is too early to start pumping?
She wants to solely pump and then give via, well, okay.
Correct.
So actually there's more women that do that than I was surprised when I started getting more and more women that just wanted to pump and give. So they wanted the baby to have the benefits of breast milk, but they wanted it via bottle. So daycare or a babysitter or even dad could give it. What you want to do is you want the baby to ideally get the colostrum. And since it's such a small amount, I would recommend, if possible, to put the baby to breast immediately postpartum and to try and get that colostrum that the baby can only get. I think if you try and pump it, it's such a small amount, I don't want people to start losing that. So I would say even if you did it for a couple of days, because usually by the third or fourth day, your breasts feel like they start in the middle of your back and then go to the front, you're so full. So you can almost, you can't miss it when the milk is in. And at that point, that's probably a good time to start pumping then. Because you know what you're doing and there is milk there to get expressed. And ideally, if you have a double pump, that's ideal. Otherwise, pump one breast and use your forearm and compress gently the other breast so you're not dripping breast milk and losing that while you're pumping with the one. But if you have a double pump, then you're all set to go. So I would say wait till the milk is in.
Okay, great advice and great description. That's exactly what it felt like. Okay, here's another question for you. How do I know when it's time to stop breastfeeding? How can I tell what is the normal learning curve and when it's just not working?
Is that because the baby is 2 years old and you want to stop? Or is that the baby's not interested anymore? Or is that the mother wants to stop breastfeeding? That would all depend. Like, when do you want to stop? You don't have to. I mean, the American Academy recommends, I believe it's 1 year of age, that you solely breastfeed, if possible. Now, that's pretty ideal. If you can do it for 6 months and then maybe do some supplemental or pumping, that's fine too. But I know they're trying to get it such that you can do it for the longest amount of time possible. Now, some mothers are earth mothers and they're breastfeeding until the baby stops pulling up her shirt and nursing in the doctor's office. Not too many women want to do that, but there are some. So I guess it depends on whether the mother wants to do it or how pumping is doing it. Is she back to work? Is the baby interested? Is the baby teething and biting on her nipples? So I think there's a lot of factors, and one of them is how is it going between the mom and the dad? Is she getting good supports? And then from there, between her, the baby, and her partner, hopefully we'll make the best decision.
Okay, that was great. Thank you so much, Deb. We really appreciate it. Wonderful input and advice and very helpful to everyone.
Thank you.
All right, since tonight is health and wellness, we are not just talking physical health, but caring for our mental health is just as important, sometimes actually more important. I'm now going to hand it over to Krista and Kelly, who are social workers with Best Self Behavioral Health, and they're going to share a bit about mindfulness with all of us. Hi, guys.
Good evening, and thanks for being with us tonight. I'm Krista Kolmangorski, and I'm joined by Kelly Ducato. We're clinical social workers, as Mary said, at Best Self Behavioral Health in our parent-child interaction therapy program. So Liz, if you want to go ahead and get our worksheet on the screen, and Liz will be sending everybody our worksheet. Kelly will be monitoring the chat, so please type in any questions, and we should have some time at the end. And so as we now shift from a physical health to mental wellness and mindfulness, I want to start us off with a mama mantra of present, not perfect. And so mindfulness, a superpower, is about slowing down and bringing attention to the big and small moments in each day. It's noticing, appreciating, and accepting. We want to attend to what is happening around us, inside of us, what we are doing, and how we are feeling. Mindful parenting refers to parenting consciously and intentionally with compassionate awareness of our own feelings and needs, while also tuning in to the feelings and needs of our children. When we slow down and attend, we can respond rather than react. Mindfulness gives us the ability to respond calmly and thoughtfully, no matter what is happening around us. Mindfulness does not always mean focusing on one person. It means paying attention to what is arising in the present moment. We can then find moments to naturally encourage our children's flexibility and cooperation while we strengthen emotional safety, security, and loving connection. Showing up in this mindful way leads us to authentic and attuned connection with ourselves and with others. The kind of thoughtful presence is especially important for interactions with our very young children. And so this means accepting what is happening. So for example, mom can accept a toddler's temper tantrum and respond to it without judging the toddler or themselves as selfish or bad. In a larger sense, non-judgmental acceptance means that parents recognize the struggles in parent-child relationships are normal, that parenting can be challenging, and learning new skills and abilities for children can be difficult. Perfect, Liz, thanks for scrolling. And so there's a growing body of research that tells us that mindfulness practice can have significant benefits. It tells us that mindfulness can strengthen the parts of our brain that help us to stay calm and be good problem solvers. It tells us that parents are able to be responsive to their children. We know mindfulness can decrease maternal stress and anxiety. It increases sensitivity, attunement, and acceptance within the parent-child relationship. It decreases overactive parenting, increases child responsiveness, decreases child internalizing and externalizing symptoms, increases your co-parenting abilities. There's a higher maternal self-efficacy related to breastfeeding when we use mindful practice. And we also can increase self-compassion around moms. So some people think that practicing mindfulness means silent meditation, that you must sit still and work to quiet your mind. While there are many forms of meditation that are mindful practices, there are also a lot of other ways to practice too, really simple things that you do into your regular daily activity. So a really nice starting place can be identifying something you find soothing. Not only is this developing mindfulness, it is also an act of self-care, a conscious act of self-care. So for example, if you love tea or coffee, choose a time where you normally have a cup and spend 2 minutes, and really 2 minutes at a time on your phone, and savor that experience. Bring attention to the experience, so notice the smell, the taste, the feel of the mug in your hands, and or the tea in your mouth. You can also practice mindfulness activities with your young children too. And so I'll talk you through a few tonight, and there's some examples on this handout too. And they're really designed to help both you and your child experience a sense of calm connection. And so we can tune into our body. And so this means really feeling the feeling of our feet grounded on the floor, or the feeling of the chair supporting us. It means focusing on good feelings. So when you're in a moment of having fun and feeling connected to your child or partner, pay close attention to how that feels in your body. Notice where in your body you feel joy and love, and really take a moment to savor and appreciate those feelings. You may say to yourself, this is what well-being feels like. And so if you look at pleasure gazing, you can start this with your infant. And so the steps are on your worksheet. It's really taking a few minutes to notice all the details of your child's beautiful face and engaging all of your senses. You might follow their lead, so choosing a time each day to play and follow your child's lead, copying their actions, observing what they appear to enjoy playing with. You may decide to have a musical moment, which will be playing a favorite song that you might enjoy and seeing how your child reacts. Another example on your worksheet, a mindfulness reset. So stop. It's one of the most well-known and cherished brief mindful practices to use during the day. Our bodies and brains know the visual cue of the stop sign, so we can do this during the day too. We're going to stop and pause, take a few deep breaths, observe what is happening with your thoughts, and then proceed in your chosen way. Consider using this if your baby is crying or your toddler is screaming, and it can lead to you responding rather than reacting. Self-compassion is a natural, caring response to suffering, both big and small, in ourselves and others. And adults deserve self-compassion for themselves. And so in parenting, this means avoiding self-blame when parenting goals are not achieved. Self-compassion helps us to shift from a stance of self-criticism to one of self-care, warmth, and love. Self-compassion is very useful in moments of stress or when you notice you're criticizing yourself or judgment is coming into the surface. And so this practice may look like taking a few deep breaths with a long, slow exhale. We might acknowledge and name the emotion we're feeling, and we're going to notice any tightness or discomfort in our bodies while we're continuing that breath. And then we're going to intentionally bring kindness to ourselves. This may be through an affirmation, like on our handout. So we might say, I am enough, or this is really difficult. And so while this process may not feel natural the first few times you try it, over time, through showing yourself love and compassion, it can become a powerful tool to help yourself feel calm and cared for, even in your toughest moments. And so to make mindfulness easier, try scheduling a few minutes for it at the same time each day, like every night before dinner, or be mindful as you're doing a daily activity, like walking with your baby. Thanks for being present with us tonight. And we have a few moments to answer any questions in the chat.
So I don't see any yet. I was just thinking how soothing it was just to listen to you talk, even.
Oh, thank you. That's really fun.
I know. I was thinking like I could listen to that every morning and start my day out with that. And, you know, that will make me have a better day. It's really great reminders. We are going to take some questions, but you know what? Something we're going to dig a little more into is postpartum depression. And we are so lucky to have a brand new organization, the Western New York Postpartum Depression Connection, who in a few minutes are going to join us live as a talk through. But wait, first, Liz, should we take more questions from Kelly and Krista? Yeah.
I did see one come through. I just sent it over to Kelly. So yeah, let's take another one for her.
Okay, good. Sorry, ladies.
Oh, that's okay. So one of the questions that came through was, what would you say to someone who finds it difficult to be still?
I would be really thinking about a mindful practice with movement. And so whether that, the weather is changing, so walking outside might not be too practical for everybody, but yeah, mindful practice does not have to be kind of meditation and sitting still. I think a lot of people do find that challenging, and it's definitely a misconception with mindfulness practice. So you really putting on a song and dancing and feeling your feet in the ground and your body moving can also be a way that you start incorporating a mindful movement into your daily routine with you and your baby.
And I think too, setting small expectations. So not expecting to sit there for 20 minutes and to be mindful. I think starting with very low, even a minute, I think of being mindful can really be helpful. And then you'll learn to be able to build that up over time. Another question, can I do this with my baby?
Yes, you absolutely can do it with your baby. So on the worksheet, you'll see a gazing activity that you can do right with your baby. And so another way to utilize gaze would be to follow along with what your baby is gazing at and really attend to what their senses are doing too, because you're bringing your full attention to what your baby's looking at.
And then we did have, another one came in, how else do I involve my family in mindfulness activities was one, and then we have one more after that.
Okay, and so family, probably partner. So you can teach your partner these different activities that are either on the worksheet or we have some links at the bottom for some additional examples too. But really your partner can be doing that with you. I said mom, but it is, partners, mom and dad or. Yeah.
And then this one kind of ties into it too. Is there an example of an activity to start teaching mindfulness to a small child?
Yeah, and so there is, I did not talk about it, but there's one kind of breathing activity called starfish breathing that I really like to teach the families that I work with at Best Health. And so you really can kind of trace the outline of your hand up and down. So you will, so depending on how old your young child is, and so if it is a toddler, you might be tracing their hand, mom, but if you have a kind of preschooler, they can imitate with you. And so as you're going up to your thumb, you're going to inhale, and then the down is exhale, and then the up is inhale, and then the down is exhale. And you, your baby can be in your lap for that too.
Thank you so much, ladies. That was really wonderful and very helpful. Okay, so something we are going to dig a little more into now is postpartum depression, and we are lucky to have, like I was mentioning a bit ago, a brand new organization, the Western New York Postpartum Connection, who in a few minutes are going to join us live to talk through how to care for yourself in your baby's first few months. But we've got a great clip first from our Expo sponsor, BlueCross BlueShield, that will talk you through postpartum depression. Then we'll get to your questions live.
Okay, we're going to jump right in. What is postpartum depression? I know, actually, it's so nice that there's so much dialogue and discussion going around for new moms. We talk about it often, and I know that providers, OBGYNs, and other providers discuss the signs and symptoms, and they may ask you if you're feeling different along the way, especially after you've had babies, right? So some of the common things that we might talk about, discuss, and review are a state of persistent sadness or anxiety. I always equate it to if you're a new mom and your family came over, they want to see baby, you're cooking dinner together, right? And in the midst of cooking dinner, you're not fully present in dinner or conversation, but you're thinking about all the things you're going to do afterwards. I know women in general, this is a common theme for us, right? For moms of any sort. That my mom always says, I'm going to be 40, and she'll think of sometimes where she's super anxious because there's a lot going on. Anxiety is thinking about things that you have to do in a future state where it gives you a feeling of unrest, unease, you don't feel the greatest, and you're just in a state of worry. So if you find that you're not enjoying that dinner that you would normally enjoy, and you're thinking about all of the things that you need to do instead of enjoying the time with the family and dinner, then those are some early signs of anxiety. If it gets to the point where you're so uncomfortable, where you can't think about anything else, then your anxiety is getting progressively worse. Okay, depression is, sorry, we're in COVID time, and my dogs and children are all at home too, causing me some anxiety. So there you go. So depression is a little bit different than anxiety, but I'd like to point out that anxiety symptoms, if left untreated, can lead to depression as well. So they're kind of interchangeable. So if your postpartum depression symptoms, sadness or anxiety, last longer than 2 weeks after giving birth, that's certainly a sign. And it can happen anytime in the first year after birth or when weaning baby, breastfeeding, sleep schedules, different things like that. So a lot of misconceptions from moms are that, well, it's been 6 months and I shouldn't have postpartum symptoms. I'm just going to ignore it, or things like that. Well, the actual facts is that up to the first year of birth, moms can experience an influx or reduction in hormones. There's a lot of things at play that can cause or trigger these types of symptoms. Certainly, you're adding a new human to your normal routine, which throws everything off kilter. You add hormones into the mix, and it's sometimes a feeling that's not something that you can control very easily, and you may need to have some help. Okay. Another interesting point is that some of the symptoms can start during pregnancy. So we think you can only have postpartum after baby, post, right? Well, some of those symptoms can start happening early on in pregnancy, could last throughout, and then get worse after you have the baby. So, checking in with yourself and regulating and writing down some things is really important during the process. The last bullet here is stating that postpartum depression can also happen after an abortion, after a miscarriage, an interrupted pregnancy, stillbirth, or adoption process. Okay. Okay, postpartum depression statistics. It is most common after childbirth. It's one of the most common complications that a mom can experience. It affects 1 in 9 women. And you can see here the numbers are pretty high, all right? Postpartum suicide can occur in 19 to 30% of women with postpartum depression. So those are the symptoms like, I should be the mom, the superhero, I can handle it all. And we know that's not the case, and you don't need to be the hero. You can ask for help and you can get support, and just knowing about it, that you can experience these symptoms and feel overwhelmed is a good indicator to reach out for help before you get to the point where you're contemplating suicide. Or even if you are contemplating suicide, knowing who to call, how to ask for help and get the help you need. It is the #1 leading cause of maternal death. So really, I mean, it's really important to be checking in on these symptoms and keeping track of your own ways of coping, dealing, getting support, asking for help, and not feeling like mom has to have all the answers, because we don't. That should be a big banner. We don't have all the answers. We try, and we'd like to think that we do. I'd like to think that I know everything, but I don't. And we laugh often about it, but it's really true, and it's okay to say that you don't know. Okay, what causes postpartum depression? Just like I said earlier, hormonal and biological shifts. You have baby, there's a lot of flooding of things. You have hormones up, down, all around. It's a decrease of estrogen and progesterone after birth. So all these endorphins and things are flying around. It's really hard to kind of stabilize some of those thoughts, feelings, hormones. And sleep deprivation. It's a funny thing. They always say, oh, you know, nap when baby naps. The house can wait. There has not been a truer statement ever said than that one. If baby's down, the laundry can wait. There's always the next day. Or, you know what? Moms love to come over and help out in any way that they can, right? Pass it down. They know what you've been through. They might have experienced some postpartum depression symptoms themselves, and they know that you need the extra help during that time. So sleep when your mom's over, let them do some of the work, or ask for help from your partner. What causes, again, continued psychological factors. So if you had a rough or tough birth, delivery, or experience, you already have anxiety. So you have anxiety, you've had anxiety or lived with anxiety for your whole life. The hormones don't help with some of that stuff. So, you know, if you're seeing an outpatient counselor, have for years, or you're taking medications to help anxiety, it's certainly really, really important to keep your provider in the loop as far as who do you talk to? What medications are you taking? How can it affect you long-term, and how can it affect you? Okay? Loss of a sense of identity when you're giving 100% of yourself to somebody else and you're not able to do that self-care like you usually would do. Because baby's crying, because you're breastfeeding, that takes a lot of the time out of you. You kind of feel like you were always on to feed baby and be part of baby. So finding some ways to reinvent what you typically would do for self-care is going to be really important in those situations. Any sort of disappointment if relationship wasn't you know, perfect. Maybe you're arguing a lot with your partner. Or other disappointing situations, you know, you're not able to work like you normally would do. You find identity in your work in different situations like that. Feeling less attractive, weight gain is just a common, you have a baby, you have this other life that you're responsible for, and you're eating more calories. So and then your milk comes in. All of these different situations that can be a factor into not feeling as attractive. Some of the social factors you can think of, young or first-time moms, I am a mom of 3 boys, and certainly when I had my first son, I was close to 26. I had been in college, finished my master's degree, and here I am ready to have a baby. And I, again, going back to that, I feel like I should know it all. It'll be fine, and you don't, and that's okay, right? There's a lot to learn. There's a lot to feel out. You're not used to feeling any sort of difference and being responsible for a little life, right? Single mothers without a partner, not getting help, can be another social factor. Mothers of high need infants, if your baby has a complication and they need some extra supports, if there's developmental disability. I would like to point out too, it's so funny, we're going through all of these things for mom, but most of you who have our health insurance benefit also have the support of all this wealth of knowledge in our case management team. So moms, if you have a high need infant, I just want to throw it out there. We do have a child-specific case manager on the physical health team and our behavioral health team that can link you to supports in the community. So again, you're never alone, no matter if it's a social factor, a feeding factor, or other. We can help you out in any instance. This is adding to it: financial troubles, pain or delivery complications, comorbid medical or substance issues. Sometimes if you had a substance use issue and you found out you were going to be having a baby you were expecting, there are things that we can help to connect you with to have a successful pregnancy and to help the baby post-delivery. And after. So in any of these situations, if you contact us at BlueCross BlueShield of Western New York, we are able to support you. So really, there's no instance where we wouldn't be able to help support, monitor, and get you in the right direction for any of your needs as a new mom. Okay, going on. The baby blues is not postpartum depression, okay? So postpartum depression versus the baby blues, and this is oftentimes something that we talk about, well, it's just the baby blues. But you have to know the difference between two, because you have to know where's the line between typical response to birth and atypical, okay? So like we talked about before, postpartum depression, it lasted more than the 2 weeks. So the baby blues are highs and lows that occur during the first 2 weeks or so after birth, and it can include negative feelings, irritability, your count in, mood swings, and that anxious feeling, but it doesn't persist after those 2 weeks. So your body gets used to the hormones, it regulates itself appropriately, and it kind of dissipates, it goes away after the 2 weeks. And you don't see it again for that first year of the baby's life, right? So that's a normal baby blues response. Postpartum depression, as we know, is persistent sadness, persistent anxiety, lasting 2 weeks and longer, and up to the first year of birth, or can happen anytime for that 2 week period of time during that first year. Okay, so there's a difference. And here, this is again some of the symptoms that you might experience for longer than that 2 week period. So mood swings, sadness, anxiety, a panic attack. Some people in a panic situation or panic attack situation feel like they can't breathe, their chest tightens, they feel like they're having a heart issue or concern, heart attack, and they're not able to come out of it very easily. It lasts for any amount of time where you feel like you have no control over your feelings. Confusion, crying, difficulty concentrating, memory loss is a big one too. Moms who are really overwhelmed feel like they can't remember, when did I last feed the baby? When did I last, what was the date on the milk? Any number of things. Do I need something at the grocery store? Oh, I forgot. When's the last time I showered? That could be another one, although I'm sure somebody else in your environment could tell you that. Again, going down the list of symptoms, there's some more: feeling overwhelmed or inadequate. Again, irritability, anger, guilt, changes in sleep or appetite that's outside of that normal mom insomnia time. Memory loss, just like I said before, excessive concern for the baby. Anxiety can start looking like that, but if it progresses to where it's like an obsessive, intrusive thought in your brain, where you're not sleeping, it's really affecting how you're functioning, and it lasts for a couple of weeks, you really should see a provider right away. And you can always, like I said, call us and we will refer you to the best provider, but your OB/GYN is also going to be following up with you. And you can feel free to outreach your OB/GYN or BlueCross BlueShield. We can direct you. Disinterest in the baby, so the opposite of overly obsessing about baby and wanting to do a baby, not having any interest, really not wanting to care for the baby, maybe leaving the baby for periods of time and then feeling bad after. Fear of harming self or baby, loss of interest in general, like not finding joy in things or not smiling, things like that. Somatic symptoms, headache, chest pain, hyperventilation, that's really tied to panic attacks too. So those are some of the common physical symptoms that you might be experiencing when you're having a panic attack too. And intrusive thoughts, thoughts that you can't control. What places you at a higher risk for postpartum depression? These are really big ones. These are ones that I know early on as a young mom myself, the list of symptoms were not always reviewed with me. So I really appreciate this list because I always say to my husband that I was a mom who did pregnancy well. I was a big mom. I just was. I gained a lot of weight, even though I was doing everything right. I was walking every day, eating really healthy foods. I liked to pack on the pounds when I was pregnant. And that put me at a higher risk. That's one of the risk factors. So a traumatic birthing experience. Maybe you were in labor for a really, really long time, the baby got stuck and then you had to have a C-section. That could be an example of a traumatic birth story. Or something else happened. Unplanned pregnancy, where you didn't have the time to really prepare for it, get the support that you need and digest that big change, life change. A recent stressful life event. I know sometimes there's been situations where a mom's expecting, and this is like a family event, right? Everybody comes together and they celebrate you, they support you. Look at how over the years new moms do the gender reveal and the big announcements and everybody's around, right? If one of those loved ones has something happen to them, in working themselves up to this event and they were a huge support to you, that can affect a lot of those things. Relationship issues, not getting the support that you need from your partner, the excessive weight gain, fertility issues, and exhaustion. So I'm telling you, exhaustion leads to a lot of the other signs and symptoms that we're talking about. Lack of sleep. So we talked a lot about your signs and symptoms, but how does postpartum depression impact your new baby, right? Children can become themselves irritable. I know, I remember my grandma, she's since passed away, but I was expecting all my boys, and her saying, well, Allison, you're just so relaxed. The relaxed moms, the babies are always calm, they're just so happy. I'm thinking to myself, that must be saying something because I don't feel very relaxed, but she always made that statement, like you're so relaxed and it shows in your baby. There's something to be said about that. So if you are relaxed, you learn good coping skills, you use the resources that you have at your disposal, you ask for help without feeling bad about it, it sometimes can help you feel relaxed, and when you're relaxed around the baby, they have a better response. So it's not as stressful and as time consuming taking care of a child who is picking up on your vibes. Kangaroo care, you think of the dads with their shirts off and them bonding. There really is a lot that goes on behind the scenes if you think about it. For a baby who can't talk, can't speak, they pick up on all of those nonverbal symptoms, signs, symptoms, whatever you want to say. Okay, so the children can become irritable, rejecting of the caregiver, developmentally delayed. So those cues, those nonverbals that mom has with them making googly faces, smiling. Those are all part of the normal developmental process of a child. If you're not engaging and doing some of those things and you're really aloof, your child can experience some delays. Language issues, late talkers in some instances, but there may be some other things going on too that you would want to check out. Increased susceptible to illness, ear infection, a lot of other things going on, autoimmune type of things. The child seems withdrawn or depressed themselves, and ongoing emotional disorders. They have a hard time regulating their emotion for whatever reason, whatever the sign or symptom that mom is experiencing may be causing some of that. Not to add more guilt to the table. I mean, certainly that's why we want all new moms and new babies to have a good experience all around. And again, the point here that you're going to hear me say over and over and over again throughout this presentation is that asking for help is okay, and there is help out there. Now we're getting into who can help you. Your OBGYN can certainly help, and they have referrals, they have brochures, they have so much more information than they ever had for new moms who have had a baby again and never experienced it. Maybe this birth is different than the other ones you've had. You know, this presentation is for the new moms so that you're aware of it, but even moms who have had a baby before can experience some of these signs and symptoms. Your family doctor, if you really trust them, and certainly they have that information as well. A psychiatrist would have that. A nurse practitioner would also as well. A PA in a doctor's office or your OB's office could have it. There's also the postpartum support international hotline number that was attached to here, which is really, really helpful. If you are having trouble maybe leaving the house or confiding in your doctor, you can certainly call and make an anonymous call to somebody who would be able to support you and help you. You know, we didn't add to the slide who internally in your health plan. Nobody thinks like, oh, I'm just going to call the number on the back of my card to get help. But you can, and I encourage you to do so. I know at BlueCross BlueShield of Western New York, we have several New York State licensed clinicians who are licensed mental health counselors, licensed social workers, and we're able to point you in the right direction, have a listening ear, and we try to support you in any way that we can. So solutions, again, being open, make a partner part of the treatment plan, asking for help if you can't, having the provider suggest that your partner help you, okay? Creating alone time. It's okay to take an hour to yourself and take a bath, read a book, go for a walk without anybody with you. And it's okay to also spend time as a family without visitors for a period of time. Sometimes it gets really overwhelming to new moms because everybody wants to see this beautiful bundle of joy that you brought home, right? And a lot of times you're trying to like sort through stuff, get your house back in some sort of routine and order. And that kind of chaos can trigger a lot of these emotions. And it can lead to maybe some of the symptoms lasting longer than you normally would think that they should.
Thank you so much, Blue Cross and Blue Shield. It's a tough topic to talk about, but it is so important. So a great segue into our next speaker, Julie Rosinski. She's a certified perinatal mental health counselor, licensed social worker, and the vice president of Western New York Postpartum Connection. Thank you so much for being here, Julie.
Thank you, Mary, for having me, and thank you so much to EPIC. We're so excited to be here. We are a newer organization. We started off as a website back in 2017, and then just recently this spring established ourselves as a nonprofit organization. So we've got a lot of great plans for how to continue to bridge the gap between, you know, moms and mental health services to support our mental health postpartum. So that was a really nice overview of postpartum depression. It really is the most common complication of childbirth. So what I'm going to talk about tonight are ways that we can hopefully prevent postpartum depression or if you are experiencing any sort of postpartum depression, anxiety, or other mental health concern, how you can utilize certain resources to support your recovery. So the Western New York Postpartum Connection website focuses on mental health, and also we bring in all of the other supplemental types of services that we think are necessary in supporting the whole person, supporting mom postpartum, and families too. We know that postpartum depression and anxiety can affect the whole family, so we don't want to forget about partners and other children, other situations. So basically, a lot of moms struggle. You know, I think one of the myths is that the postpartum mental health is all about hormones, and there certainly is a hormonal component to it, but there's also big interpersonal changes going on. You know, like was mentioned in the little video, that you're bringing a whole person home. So this is probably the biggest change that you'll go through ever in your life. So there's a lot of adjustment issues. There might be role changes or adjustments in your relationship with your partner. There might be communication issues that come up. There might be changes in your friendships. You might be the first person in your friend group to have a baby, and maybe your other friends just aren't there yet and don't really get it. So you might start to feel isolated and alone. There might be changes going on with your job, you know, having to take baby to daycare, or having to change your job because of being a mom now. And different conflicts that might happen with extended family or in-laws or different things like that. So it really is important to access support. And hopefully we can access that support within our immediate circle and our friends and family. But sometimes, you know, we have to reach out to other supports. So we might have to reach out to our spiritual community. We might have to reach out to a mother's support group. On our West New York Postpartum Connection website, we have a lot of different tabs at the top, and there are tabs for different community resources and support services. And we have a variety of support groups listed. And a lot of them are virtual right now. And we have some specialized support groups listed specifically for women of color. We have specialized support groups, there it is, for Jewish women, support groups for individuals maybe who have gone through some losses. So there's our support group tabs. And again, a lot of support groups are currently running online. We also have some national support groups through Postpartum Support International. In terms of support, you might consider hiring a postpartum doula. Doulas, we typically know them to be people that help with birth support, but we do have doulas in our community that serve a postpartum purpose, and then they come to your home and help you with light housework. They help you maybe with some bonding and breastfeeding. They help, you know, maybe some of them do postpartum massage. So you might find it beneficial to access their services. Definitely, you know, we had a nice presentation earlier too about lactation support. So lactation support can be really helpful postpartum in preventing or managing postpartum depression. If you're a mom who's choosing to breastfeed, we know maybe it's not as easy as we think that it's going to be. You know, I think we've all kind of believed the myth that you just put the baby to breast and everybody knows what to do, and sometimes it's not that easy. So there, we have a lot of lactation consultants under our community resources tab that will, some of them will come to your home, some of them will you know, see you within their agency or their store. We have some that are doing even online consultations in this time, you know, with COVID. We know that that is something that's really important. We also have resources listed for moms who are choosing not to breastfeed. We have the Fed is Best Foundation, which, you know, teaches guidelines for safe formula feedings. There's not a lot of information out there about safe formula feeding and other feeding choices. So having somebody that can help you with that big transition as well can be really helpful. Sometimes breastfeeding definitely can support a mom's mental health, and sometimes it adds to mom's mental health and stressors. So having someone that you can talk to make some of those decisions about breastfeeding can be really helpful. Sleep, exercise, and nutrition, supporting your physical health. Again, looking at this from a whole person perspective, you're recovering from giving birth. You are most likely sleep deprived. All of these things making you a bit more vulnerable to possibly having some mental health complications postpartum. So again, accessing support from family or friends, if anyone that can help you sleep, anybody that can take an overnight feeding, anybody that can come over during the day and help you take care of the baby so that you can lay down and rest. Again, people that will bring you meals potentially, that will help with light housework so that you can rest your body, you can rest your mind. And then once you're, free, and been approved by your doctor to engage in some light exercise, under our community resources tab, we also have some resources for yoga and exercise classes, and other, specialized postpartum physical classes. We also have pelvic floor therapy and pain relief. Some mothers struggle after giving birth with pelvic floor issues, and it's very, very common, and I think people dismiss it as normal, but it doesn't necessarily have to be that way. We have a lot of pelvic floor physical therapists listed on our site that can help you if you're struggling with any muscle issues or pelvic floor incontinence issues, different things after postpartum. So certainly looking into that, speaking to your doctor about that, as it doesn't necessarily have to be that way. And certainly in looking at specific direct mental health care, the vast majority of women will experience some sort of baby blues, for example, which is usually in the first couple of weeks postpartum and not necessarily a serious thing. It's more of adjusting to hormones and adjusting to the new lifestyle that you now have, now that you've brought your baby home. But sometimes, as they were mentioning in the video, if it lasts beyond 2 weeks, if it's getting progressively worse, if you're noticing any thoughts that scare you, if you're really losing interest in things that you used to enjoy, if you're noticing problems within your relationship, then it might be time to seek help. So under our tab, Find a Mental Health Provider, we have listings of therapists and counselors, mental health agencies, psychiatric providers, so moms might be able to find, we have it broken down by location around Western New York. We have resources in all of the different towns around Western New York and also some parts of Rochester. So we have private therapists and counselors, and we also have mental health agencies. For example, our presenters right before this, Best Self, we do have individuals who have specifically been trained in postpartum mental health issues at some of the local agencies. And so we make sure that the therapists that we list on our site are people that we know have had specialized training in mental health for postpartum women. We've had women sometimes who've had experiences where, they have a wonderful therapist and a very well-meaning therapist, but somebody that just maybe doesn't get the postpartum piece. And so then they kind of feel a little misunderstood in some ways. So we've made sure that everybody that we list on our website has specific mental health, postpartum mental health experience. Some women do opt to take medication to help with postpartum depression or anxiety. That can sometimes be done through your OBGYN, or sometimes you might want to get in touch with one of our specially trained psychiatrists or nurse practitioners that can prescribe that medication. And certainly that can be a really helpful thing for a lot of women to consider medication as part of their support. We also have resources on our website for books, informational websites, different podcasts. Sometimes, maybe you're not at a point where you really are ready to access therapy, but maybe you're in a place where you want to look into this a little bit more. You're questioning, do I have a concern about postpartum mental health, or is this, going to pass? So some of the information on our recommended reading, websites, etc. You'll find books, websites, podcasts, a lot of great information about postpartum mental health. And certainly if any questions come up whatsoever, if you go to our website, there is a way to contact us and send us an email. We're linked with all of our therapists, so if you're looking for something specific, or if you're having trouble connecting with a service or a mental health provider, you can email us at info@westnewyorkpostpartum.com, and we can get back to you and help you link with someone. So I'll certainly take any questions if anybody has questions. Let's see. So I see one question. I had postpartum depression after my first baby. Will I have it again after my second baby? Not necessarily. There is some evidence to show that if you've had postpartum depression after one pregnancy, you're at a higher risk of having it again. However, a lot of times what I find with the women that I work with is they learn a lot from their first experience. And a lot of times they access therapy before they have the baby to connect with a therapist and work on these prevention issues. So we try to figure out, well, what happened last time that was less than ideal? Well, I didn't really have a whole lot of support, so I was feeling really isolated, or I really struggled to ask people for help because I'm so strong-willed, So we talk about strategies to hopefully prevent it in a subsequent pregnancy. I see a question, can postpartum depression go beyond a year, depending on some situations? Yes, I suppose it depends on if you're dealing with like the clinical picture of it or just the general picture. Technically, clinically speaking, it's within the first year. But sometimes the interpersonal problems continue, or sometimes a lot of women, again, we were talking about post-weaning depression. Sometimes women reach out to me when they're 6, 7, 8 months postpartum because maybe they've been trying to deal with it on their own. So certainly, it doesn't matter if, you're
Julie, that was so informative and so important, and what a wonderful organization. Thank you so much.
Thank you.
Really appreciate it. It's so important to remember to ask for help. There's nothing wrong with asking for help, and check on your family members that just have babies. My daughter had a baby in February and I was so worried, and I just kept checking on her, and maybe nagging is not the right word, but it's, you just have to really check on those around you too. So Julie, thank you so much. We really appreciate it.
Thank you.
Okay, so what a way to close out our evening. We are going to move our bodies. We're going to get a baby-friendly yoga flow and then give away tonight's prize, a Swaddle Me Side Sleeper. Megan Callahan is here from Yoga Parkside. And Megan, I don't know if you remember, but I used to bring my daughter Ella there when she was a baby. But they have prenatal and postnatal yoga classes, classes for kids, and also classes for adults. Right, Megan?
Yes, and I actually totally remember because you were saying, I don't know if my daughter is going to be still for yoga, which I think is a really yes, it's something we should address because toddlers, of course, are not going to be still for yoga. Mine may be hijacking the class right now. So yes, we're just going to do a brief practice, and I saw some kids on the screen. Sweetie, I'm doing my class now, okay?
We did Snow White and it's too scary for me.
Okay, I'll be right down. Okay, so I am a mama of 2. Here's one of them. And I started teaching baby and me yoga when my older son, who's now 7, was only 2.5 months old. So I've been teaching baby and me yoga all the way through, prenatal, postpartum, and it's so exciting to hear about all of these resources. And as Liz knows, because she also teaches at Yoga Parkside, we have toddler yoga. So when we're talking about introducing mindfulness, we say that they're never too young to introduce, but we basically say that a baby already starts modeling mindfulness in the womb. And that I've watched babies actually recognize hearing an om when they come out, when mom has done prenatal yoga. I love you so much. Goodness gracious. Okay, so he's gonna be here. That's how it goes. So one of the things about this is actually a word that I really love. There's a great book called Mommy Mantras, and I'm excited to connect with some of the really great practitioners here because I think we all have a lot of really complementary things that we do. And so yoga, like Krista was talking about, is the somatic practice that involves mindfulness. So we have ones that involve stillness, but yoga is when we're giving attention. One of my favorite definitions of yoga is to tie the strands of the mind together. And there are very few times where we feel so scattered in so many directions as early in motherhood. We feel pulled in so many different directions. And so yoga, whether we have a child, as is going on with me right now, on our body, or we are solo, we are able to do this at any point, anywhere. So I'm gonna show you just a couple simple things, including my favorite yoga pose of all time, which is called legs up the wall pose. And I had a little duck, but I'll use my son. And what I was going to say is terms, I love this, mindfulness is a superpower. There's also a great term called momfulness, which is this limited time. And I find our yoga classes, whether they're prenatal, we try to help support a childbearing person all the way through their journey. Stress relief for conception, through prenatal yoga, postpartum yoga. We also have some postpartum groups that keep working in meditation, pranayam, all kinds of ways to work this into your day for this massive, massive life change. So getting into the body is really important, even if you're in the midst of mothering. So right now, wherever we are, let's all just take a second to notice whatever surface we're sitting on, whether it's a chair or the floor or a couch. And I want you to just notice the part of your body that's making contact with that. And to notice the temperature of the air on your skin. So what's the temperature like in the air right now? And just notice the air moving in through your nose and out through your nose. And I think an important thing as I'm demonstrating about mindfulness is it's not all about peace. It's actually about a state of focus. So even when we're in the midst of things coming our way, we can switch into that sensate and mindful focus and just experience what's happening. So I want you to just bring particular attention now to any parts of your body that may have something to say. We have to say to our body a whole lot when we're a parent, shh, not now. Because we keep having to tend to the child that's in front of us. So for me, one of the things that yoga has become really salient for is it's now. Now is the time that I can tend to my body and I can listen. You have my undivided attention, even if it's 5 minutes. So let's just inhale wherever we are. And exhale, just release our chin towards our chest. Inhale, bring your head up, maybe even slightly back. And exhale your chin to your chest. Inhale, head up. Exhale, chin to chest. And we're just aligning. I want you to keep doing that. Bring your head up. And bring your chin to your chest. Just lining up breath and movement. One more time. Inhale. And exhale. Now inhale, bring your head up. And exhale, gently just tip your right ear towards your right shoulder. Hi, we're gonna do a song for you in a minute. Inhale, center. Exhale, left ear to left shoulder. Inhale, center. That's all we're focusing on is moving and breathing. Inhale, center. And exhale. One more time, breathe in. Right ear to right shoulder. Inhale, center. Good job. Exhale, left ear to left shoulder. Great. Woo! Then come on up, and I want you to stretch your arms up in the sky like you were trying to climb a ladder. So climb an imaginary ladder up, up and away, like you were climbing all the way into the sky. Ooh, maybe find a yawn and twinkle your fingers like twinkling stars. Ooh. Great. And then you're just going to stretch side to side. So if you have a child on your lap, you can wrap one arm around them as you go back and forth. If your arms are free, you can put one hand out to the side and go back and forth. Great. Roll the shoulders up, back and around a couple times. And since Zan is here and I see some other kiddos, we're going to do one little kid song. So bring the soles of your feet together. This is called butterfly pose or Baddha Konasana. And then they can do the same. Okay. And we're going to sing a little song about butterflies. Float like a butterfly, float like a butterfly, float like a butterfly in the sky. And you can bring them from leg to leg. Float like a butterfly, float like a butterfly, float like a butterfly in the sky. Do you think that I could put you on my shins? Could we show people how you fly? Not right now? Okay. Then I'm going to show you legs up the wall pose, which is my favorite yoga pose of all time. And the reason I love this pose, we're talking a lot about the importance of postpartum health. And I read one study that said doing this pose for 20 to 25 minutes is the equivalent of a 90-minute nap, a full REM cycle. So you'll hear this advice all the time, sleep when the baby sleeps. And I think it's really hard to actually do that, especially now in these times of COVID when people have even less help than they might have. So if you do legs up the wall at the beginning of your baby's nap, especially when you're no longer able to nap with the baby, then you'll get nice, fresh stores of energy available for you. So even if you do this pose for 5 minutes, it makes a massive difference. It helps with lower back, leg, hip pain, helps slow down and prevent varicose veins. It can help promote healthier, deeper, more restful sleep, helps with digestion. There are many, many health benefits, and it can also help elevate your mood if you're having a rough time, deeply rests the body, and puts you in a very peaceful place. So if there's one yoga pose you do a day, this is the one I suggest. And you can put your calves up on a couch or a chair for a modified version if you can't get them to 90 degrees. So legs up the wall is quite literally how it sounds. It's waterfall pose. So you sit against the wall like you're going to take a little nap. And then you send your legs up the wall like this. And then you scooch in as close as you can. Then from there, since I can't exactly show you this and talk to you, you're going to relax your upper body. Keep your hands below your heart. So either resting on your belly or just to the side. For my mamas who are pregnant, you can take your nursing pillow or a boppy and put it underneath your upper back and neck to just help make sure that your circulation is nice and healthy during pregnancy, that we're not cutting off any blood supply. And then post-pregnancy, you can just fold a blanket for a little extra pillow, maybe put an eye pillow on, some lavender on the temples. And really, I would recommend everyone here, mother or not, if you do this pose every day, especially at the end of a work day before you have to switch over to caregiving mode, if you're wearing both hats, or if it's hard to wind down, this is a great time to stop screens, go into legs up the wall, and make that transition before bedtime. So I obviously have a lot more to say, but I know this has been a full freight of wonderful, wonderful, informative things, and I really am so grateful to have been included, and EPIC is such a great organization. Wonderful job putting this together. So if you have any questions, let me know, and I would be honored to have you come hang out at our studio. Yes, virtual. So we actually, a quick video that demonstrates the poses. Yeah, so I actually have a mommy and baby demo that's about 10 minutes long that I can send to Liz and she can distribute. And we went virtual on March 16th. Our entire studio went completely virtual, and we still are. So we have some in-person, indoor offerings, very limited, and outdoor. But we have a full virtual offering, and we have a prenatal yoga series, another one starting up on Thursday nights, and then we have drop-in classes on Saturdays, and we're about to put one back on Monday night. And then we have Baby and Me, which is our class for new caregivers, which means anybody. So Baby and Me could be grandma, dad, auntie. And then we have toddler classes and basically all the way up. So I'm happy to answer any other questions, either also after I know you've been here a while. So yes, you can win a free class on Thursday. Thank you so much.
Thank you so much, Megan. That felt great. Did that feel good? Okay, don't go anywhere, because before you log off and get to all those bedtimes and story times and everything else you have going on at home, we are going to give away a Swaddle Me Side Sleeper. Our winner was selected at random, and it is, what's the name? Hannah. Congratulations, Hannah. You are the winner. Please email Liz Vetrano, Epic's Director of Development and Marketing, to coordinate picking up your prize. Her email is in the chat. So congratulations, you're gonna love it. And thank you all so much for joining us for our first night of the Expo. This is all new territory for us, so we appreciate you having us along for the journey. Really no technical difficulties, so that right there is huge. And we will see you tomorrow, same link, same time. We'll be talking parenting in a virtual world. So we will see you all then. Thank you so much. You guys are great. Epic is wonderful. Have a good night, everybody. Can you say bye?
Bye-bye.
Bye. Thank you, Mary. Thank you, everyone.
Thank you.
Bye-bye.